Hey guys, this is Dr. Hub. Today we'll look at the chlorination of water. The chlorination is widely used for the large-scale purification. So it is in large-scale purification of drinking water. It is a bactericidal and the moderately virucidal, but not sporicidal. So it is bactericidal and also virucidal, that is moderate. It is not sporicidal. It is not sporicidal. This oxidizes, it oxidizes the iron. Next comes the manganese. Then there's also the hydrogen sulfide. So it destroys some taste and odor producing components. It destroys taste as well as odor producing components. And what does this do? It controls the algae and slime. It controls the algae as well as the slime organisms. It controls the algae and slime organisms and aids in the coagulation. Now let's look at the action of chlorine. There is the hypochloric acid, and the hypochlorous acid. So hypochloric and hypochlorous acid, these are formed when chlorine is added to water. So the hypochlorous acid ionizes to form, it ionizes, and this forms the hydrogen as well as the hypochlorite ions. So let's write it in form of equation. So H2O plus Cl2 will give rise to HCl plus HOCl. Then this HOCl will give rise to H plus OCl. The disinfection action of chlorine, the disinfection action of the chlorine. So this is predominantly due to the hypochlorous acid. So this is due to the hypochlorous acid. And the hypochlorous acid, it is the most effective. Hypochlorous acid, it is most effective form of the chlorine. And it is almost 70 to 80 times. It is 70 into 70 to 80 times more than that of the hypochlorite. It is greater than the hypochlorite ions. The chlorine, it acts as best in water. The chlorine, it acts as best. This is in water. That has a pH. So that has a pH of around 7. Now let's dive into the principles of chlorination. So the principle is that the water to be disinfected, it must be clear of turbidity. The first is clear of turbidity. And this is because the turbidity impedes the efficient chlorination. So it affects the efficient chlorination. Then the chlorine demand of water. What is chlorine demand? The chlorine demand of water, it is a difference, and this will be between the amount of chlorine and this has to be added to water, amount of chlorine added to water, and the amount of residual chlorine and amount of the residual chlorine. So difference between the amount of chlorine added to the water and the amount of residual chlorine that is remaining at the end of a specific period of contact, and which remains end of the specific period of water. Specific period of contact, and this is usually considered as 60 minutes at a given temperature and pH of water, at a given temperature as well as pH of water. It has to be estimated before the chlorination is done. So it is estimated before chlorination is done. Now, the point at which the chlorine demand of water is met. The point at which the chlorine demand is met. The point at which the chlorine demand is met. This is known as the break point. And it is beyond this that the residual free chlorine begins to appear. So beyond this, the residual chlorine, it appears. The contact period of free chlorine for at least 1 hour is equal to, so contact period of the free chlorine, this is of at least 1 hour. At least 1 hour is required to kill the bacteria and virus, required to kill the bacteria as well as the viruses. And there is a minimum recommendation concentration. There is a minimum recommended concentration of free chlorine, of the free chlorine. This is 0.5 mg per liter for 1 hour. This is for 1 hour. And there is also the free residual chlorine. There is a free residual chlorine. This provides a margin of safety. It provides a margin of safety as well as the microbial contamination that occurs in storage and transport. So it's safety against the microorganisms, microbial contamination that occurs in storage. So storage and transport. The sum of the chlorine demand of specific water plus the free residual chlorine. So the sum of the chlorine demand of specific water. So chlorine demand of specific water and plus free residual chlorine, plus the free residual chlorine of 0.5 mg per liter. So this constitutes the current dose of chlorine is applied. So it constitutes the correct dose of chlorine is applied. Next we'll look at the method of chlorination. So methods of chlorination, the first one here will be the chlorine gas. So chlorine gas is the first choice because it is cheap, it is quick, as well as it is efficient in action. It is easy to apply, and the special chlorinating equipments. There is a special chlorinating equipments This includes the Patterson chloronome, and they are used for the application of the chlorine gas. So this is for the application of the chlorine gas. Then there is the chloramines. The chloramine are nothing but they are loose components of chlorine and ammonia. Loose components of the chlorine and the ammonia. They give more persistent forms of the residual chloride. They give more persistent forms of the residual chlorine, and they have a slow action. That is not widely used, and it has a slow action. It is slow, so it is not used. There is perchloron. Perchloron or the high test hypochlorite. High test hypochlorite. So in short, it is known as a HTH. It is a calcium compound. It is a calcium compound that has about 60 to 70% of the available chlorine. Next, we are looking at the breakpoint chlorination. So in breakpoint chlorination, the point at which it is a point. So this is at which the chlorine demand of water, it is met, and this is known as a breakpoint is met. This is known as the breakpoint. Then the free chlorine, there is free chlorine, that is HOCl, and the OCl. So this appears when the chlorine is added beyond the breakpoint. Appears when chlorine is added, and this is beyond the breakpoint. Beyond the breakpoint. In other words, at the breakpoint, if chlorine is added, all the combined chlorines would have been completely destroyed. So if at breakpoint, when the chlorine was added, all the combined chlorines, so all the combined chlorines, they would have been completely destroyed. So they are completely destroyed, and the free residual chlorines, they begin to appear. So the free residual chlorine, they start to appear. The corresponding dosage to achieve the appearance of the free residual chlorine is known as the corresponding dosage to achieve the appearance of this is the free residual chlorine. So this is known as a breakpoint dosage. This is a breakpoint dosage, and this method is known as a breakpoint chlorination. Then there is a super chlorination. It is followed by the dechlorination. It is used to disinfect the highly polluted waters. So you have to disinfect the highly polluted waters and whose quality fluctuates greatly. So their quality is completely variable. Next is the orthotolidine test or the OT test. This is a test for chlorination. It is a test for the chlorination, and it determines the free and combined chlorine. So it determines the free and the combined chlorine in the water, and it measures rapidly and accurately. It is rapid as well as it is accurate. The reagent used is the analytical grade. So you use an analytical grade orthotolidine, and this is dissolved, and the dissolve will take place in the 10% solution. It is in the 10% solution of the hydrochloric acid. So when added to water, they'll contain chlorine. So when it's added to water that contains chlorine, it turns yellow. So this will turn yellow, and there is a varying intensity. This is faster in presence of a free chlorine. So it is faster in presence of the free chlorine and slower in presence of combined chlorine. It is slower in the combined chlorine. Then comes the OTA test, that is the orthotolidine arsenide test. So it is known as a OTA test. So this is a modification of the OT test. It is a modification of the OT test, and it nullifies the errors. It nullifies the errors. This is due to the interfering substance like the iron. It includes the nitrites as well as the manganese. It also determines the free and the combined chlorine. So it determines the free as well as the combined chlorine separately.